Suflave 178.7 Gram-7.3 Gram-0.5 gram oral solution hypertonic laxatives is a medication that contains polyethylene glycol and electrolytes. It is commonly used to prepare the intestines before certain bowel exam procedures, such as colonoscopy or barium enema X-rays. This medication works by drawing large amounts of water into the colon, resulting in watery bowel movements. By clearing the stool from the intestines, it helps the doctor to better examine the intestines during the procedure. The daily dosage and optimal timing for taking this medication should be discussed with your healthcare provider. When using this product, it's important to follow the instructions provided with it. Some brands come with a medication guide, which you should read before starting. If you have any questions, consult your doctor or pharmacist. Before your procedure, you may need to follow a special diet and avoid solid food. The product needs to be mixed with water as directed, and then placed in the refrigerator to improve its taste. It's important to note that this product may affect the effectiveness of certain liquid thickeners. If you are using liquid thickeners, talk to your pharmacist to find one that will not interact with this product. The dosage of this product will be determined by your doctor based on your medical condition, procedure, and response to treatment. When taking this product, it's best to drink the mixture quickly and not sip slowly. The watery bowel movements usually begin within 1 hour after drinking the mixed liquid. Be sure to drink plenty of clear liquids as directed by your doctor to prevent dehydration. It's also important to avoid taking other medications by mouth within 1 hour before starting this product, as it may affect their effectiveness. If you are unsure about when to take your other medications, consult your doctor or pharmacist. Common side effects of Suflave 178.7 Gram-7.3 Gram-0.5 gram oral solution hypertonic laxatives include nausea, bloating, stomach/abdominal cramps, vomiting, and anal irritation. If these effects persist or worsen, it's important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience severe or persistent stomach/abdominal pain, bloody vomit, chest pain, fainting, irregular heartbeat, shortness of breath, bloody stools, rectal bleeding, seizures, or signs of kidney problems. While a serious allergic reaction to this medication is rare, seek immediate medical help if you develop symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so it's important to contact your doctor or pharmacist if you notice any other unusual effects. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Suflave 178.7 Gram-7.3 Gram-0.5 gram oral solution hypertonic laxatives, make sure to let your doctor know if you have any allergies to it or if you have any other allergies. It's also important to talk to your pharmacist about any inactive ingredients that may cause allergic reactions or other problems. Before using this medication, it's crucial to inform your doctor or pharmacist about your medical history, especially if you have certain stomach or intestinal problems, trouble swallowing, history of vomiting easily or often, heart problems, kidney problems, seizure disorder, or mineral imbalances. If you're planning to have surgery, it's important to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. For children, they may be more sensitive to the side effects of this drug, especially dehydration. It's best to use room temperature solution for infants. Children younger than 2 years may be more likely to develop low blood sugar from not eating, so it's important to seek medical help if you notice symptoms of low blood sugar in your child. During pregnancy, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as it is unknown if this drug passes into breast milk. When taking Suflave 178.7 Gram-7.3 Gram-0.5 gram oral solution hypertonic laxatives, it's important to be aware of potential drug interactions. Certain medications may affect how Suflave works or increase your risk of experiencing serious side effects. To ensure your safety, it's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If you suspect an overdose with serious symptoms like passing out or difficulty breathing, call 911. Otherwise, contact a poison control center immediately. In the U.S., you can reach your local poison control center at 1-800-222-1222. In Canada, contact a provincial poison control center. This medication is for use in the treatment of constipation. It works by drawing water into the colon to soften the stool and increase bowel movements. This medication is usually taken on an empty stomach, at least 1 hour before or 2 hours after a meal. The dosage is based on your medical condition and response to treatment. It is important to follow the dosing schedule provided by your doctor. Do not take more of this medication than recommended. Taking too much can lead to serious side effects. If you are unsure about the correct dosage or how to use this medication, consult your doctor or pharmacist. Remember, do not share this medication with others. Suflave 178.7 Gram-7.3 Gram-0.5 Gram oral solution hypertonic laxatives is used to treat occasional constipation. It works by drawing water into the colon, which helps soften the stool and makes it easier to pass. This medication is usually taken at bedtime or as directed by your doctor. Be sure to follow the dosing instructions carefully. When it comes to storing Suflave 178.7 Gram-7.3 Gram-0.5 Gram oral solution hypertonic laxatives, it's important to follow the specific instructions provided on the product package or by your pharmacist. Make sure to keep all medications out of reach of children and pets to prevent any accidents. When it comes to disposing of this product, it's important not to flush it down the toilet or pour it down the drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.